Welcome to Vital Signs, your prescription for a healthy family, where members of the Catholic Medical Association explore medical topics vital to the health of you and your family members. I'm Dr. Tom McGovern, the host of Vital Signs, brought to you by Shalom World TV. Today, we examine the epidemic of child abuse and neglect, how we might recognize it in our extended families and communities, and learn how to avoid falling into habits that could unintentionally harm our own children. The World Health Organization defines child maltreatment as all forms of physical and emotional ill treatment, sexual abuse, neglect, and exploitation that results in actual or potential harm to the child's health, development, or dignity. There are four main types of abuse. The first, child neglect or sins of omission, and then three sins of commission that include physical abuse, psychological abuse, and sexual abuse, which sadly affects 12% of children worldwide at least once by the age of 18. According to United States statistics, 1 in 7 children experience abuse or neglect every year. And child neglect is over twice as common as child abuse, and is sometimes due to a lack of resources of the parents. Consequences of child abuse and neglect include impairment of lifelong physical health, mental health, spiritual well-being, and relationships. And those who are abused tend to pass it on to future generations. Joining us today is Dr. Ashley Fernandes, a pediatrician, medical ethicist, and father who practices and serves on the faculty at The Ohio State University School of Medicine and Nationwide Children's Hospital in Columbus, Ohio. Ashley, welcome to Vital Signs.
Thanks, Tom. Thanks for having me. It's so good to be here.
So, Ashley, what are the most common forms of child neglect that you encounter as a pediatrician?
That's a very good question. And I just want to start out by explaining to the viewers the distinction between neglect and other forms of abuse. So typically in pediatrics, we say that neglect is an act of omission that puts a child at imminent harm or risk. And acts of physical or sexual abuse are different because those are acts of commission that are done to a child, again, that would put that child at imminent harm or at risk. And so neglect is that idea that a parent is, through omission, putting their child at risk, and there are various forms. The most common we see is physical neglect, and that is where the physical needs of the child are not met. And that's the one probably most of your viewers are familiar with. But if you really think about it, there are other kinds of neglect, including educational neglect, medical neglect, emotional neglect. And then there are even other kinds that don't quite fit into any category, like supervision. If a parent isn't properly supervising their child, and that is putting them at risk, that can be a form of neglect as well. Neglect is by far the most common form of child maltreatment in the United States.
So we move from sins of omission to sins of commission. What are the most common forms of child abuse that you see in your work?
So we typically think about physical and sexual abuse, and physical abuse is much more common, not just in my work, but of course around the country, and I believe around the world. Sexual abuse is, though, very prevalent, and physical abuse and sexual abuse are often correlated. So family homes that do involve violence typically are at higher risk of having both forms of abuse and also neglect. So the impact that any form of abuse or neglect can have on a child can be absolutely devastating. And in our country, it really is an epidemic. There was over 3 million reports to Child Protective Services in the United States in a single year. About 20% of those demonstrate abuse. And I want to say that number is very unreported. That 3.2 million is only the number that people have actually reported. But we believe, as pediatricians, as a community, we believe that it's much, much higher than that, the actual rates of abuse.
I think you're probably right. And, you were talking about around the world. Are there differences between cultures and countries about both the frequency and types of abuse and neglect that might be occurring?
Yes, that's a very good question. We know that child maltreatment occurs in every culture, in the world and has historically occurred for a long time, even if the definition of what constitutes abuse has changed. There's certainly cultural differences between what counts as abuse between countries in the West and other countries, between developed countries and developing countries. But for our purposes, recognizing that violence or even acts of omission that put a child at risk can occur in any culture, I think it's our job, both as parents and for you and me as physicians, to be aware that those cultural differences themselves can sometimes be detrimental to the child. So, for example, in some cultures in the Horn of Africa or East Africa, there is a great stigma around child maltreatment. And so people tend to be silent about it. People tend not to report it. I just use that as an example, but that happens in my own culture in South Asia. A lot of physical and sexual abuse goes on, but cultural influences make it less likely to be reported. Let me say one other thing, which this is called what we call in pediatrics the cycle of violence. So when acts of child maltreatment become generational, families tend to normalize those acts of maltreatment. And when they're normalized, they may not report it because they don't think it's abuse. Hey, being hit is part of being a kid, some might say. So there are certain subcultures in which abuse or neglect becomes part of life, and people don't see it as abnormal. And it's our responsibility to try to bring that out into the light to help that child to heal.
That's so true. Abuse should never be accepted as normal. Now, when we talk about this, a lot of parents might start to think that they're getting blamed. But there is one area of neglect where they actually aren't to blame. They aren't able to provide something that their children need because they lack resources. Isn't that right?
Yes, and I think that's a very important question and a very important point, Tom, is there are instances of neglect in which intention does not matter. Which what I mean by that is there's no malintent on the part of the parent. Mm-hmm. They simply just may not be able to, for a variety of reasons, which I'll explain in a second, be able to provide for their child's care, and that puts them at imminent risk of harm. So one area is, of course, a material deficiency. That is to say, the family doesn't have the financial resources to be able to provide food, for example, or proper housing for their child. That can be a form of neglect, but it's not intentional. I had a patient once that had a cognitive deficiency. That is to say, she just didn't understand how to take care of a baby, maybe because of a mild to moderate intellectual disability. So there, in that case, it's still classified as neglect because her behavior put her child at risk. However, she didn't intend it, and in fact, she meant very well for this child. And then there are other types of deficiencies that are unintentional. One we alluded to already, which is if a family grows up in an environment of violence, they may tend to normalize that violence and not or neglect and not even realize that, hey, this is neglectful behavior because it's become normal for them.
As Catholics, we like to talk about the examination of conscience. What can we do here as parents to see if there's something we might unwittingly be doing that might be harming or neglecting our own children?
Yeah, I don't want your viewers to be paranoid that if they don't do this or if they don't do that, I'll be neglecting my children. Remember that child maltreatment, when it comes to neglect, is something that this word imminent harm to the health of the child is very important. And certainly with physical or sexual abuse, which we know is detrimental to the child, that should never be done by any Catholic or any person ever. But I think it starts with prevention, and prevention begins with ourselves as parents, as adults, by exemplifying proper communication. As St. Francis de Sales used to say, when it comes to he was talking about other things, but I like to use this phrase of St. Francis de Sales, gentle but firm. There needs to be structure in children's lives. You can be firm about that, but still be gentle. These are children. And by imitating that behavior for our children, we're teaching them that violence is not the answer, that neglectful behavior is not the answer. I think the other thing that does, which is the key to preventing issues of child maltreatment, is the building of children's self-esteem. To me, from what I've seen from my pediatric practice, that is one of the best preventive measures. Make the child understand that they are a child of God, make them understand that they have self-value and self-worth, and they're going to be much less at risk. And God forbid, should the worst happen and they suffer physical or sexual abuse, the difference between resilience and non-resilience after traumatic events a lot of times lies with self-esteem. The way to heal yourself after an event like that is the understanding of yourself as having value. The more we can do as parents to build value that our children see for themselves is one of the best things we can do as parents.
There's so much important with this topic, but if there was one thing you would want parents to remember about child abuse, what would that important thing be?
I think it would be to look, you don't have to be paranoid about it, but certainly to remember that it is not your job to have to prove a suspicion of child abuse, but to report a suspicion of child abuse whenever you suspect it. And our standard in America is a suspicion of it is enough to report. And a lot of times we see this with healthcare providers, certainly we see this with parents. Anybody in the United States and at least in the Western countries can make an anonymous report if they suspect child neglect, sexual abuse, physical abuse. Please be aware of the signs and please do that even if you can't prove it. Sometimes parents and physicians are a little scared. They don't want conflict. They don't want to let, to ruin a relationship that they might have had. So I would ask you guys that since we know that child maltreatment is severely underreported, report it if you suspect it, and don't be hesitant to do it. You're doing the right thing. Let the social workers and the physicians figure out whether something has actually occurred. Or in the case of unintentional neglect or something like that, let's get the child and the family help that they need.
So that begs the question, what are the signs that we should be looking for that might herald child abuse?
So I think when we see in children that are neglected, one of the obvious physical signs is, for example, weight loss or the inability to gain weight. So there's a physical component to neglect. Sometimes it manifests itself in weight. Sometimes it manifests itself in hygiene. So if a child that perhaps used to have better hygiene now comes in more disheveled, dirty, those kinds of things. I think you see some behavioral problems, the inability to control their emotions, outbursts of anger. You see the regression of milestones in children. So these might be children that, let's say toddlers that used to talk and now suddenly become silent. Language is a big harbinger of possible neglect or maltreatment in the home. Sometimes wetting the bed. Children that used to be potty trained will suddenly wet the bed or even have encopresis in the bed. So looking for signs like that, unusual things, and certainly any report where a child would tell you should be taken seriously. When it comes to physical or sexual abuse, bruising obviously is the first thing we think of, but a lot of times perpetrators of physical abuse are very clever in where they bruise the child and how they abuse the child so that they hide it. So just because you don't see a physical sign doesn't mean it's not there. I want to give your viewers a little way to remember some signs for physical abuse, and that's this mnemonic that is 10-4, TEN-4, and that is torso. So any injury to the torso, injuries to the ears, injuries to the neck, and then any child under the age of 4 who has more serious injuries. Those are things that we should be a little bit more wary of. With sexual abuse, obviously a disclosure from the patient is probably our best sign, and to take that seriously and to not just disbelieve a child that comes up with something like that. Physical signs of sexual abuse are rare. So the fact that a doctor might not find physical signs of sexual abuse does not mean it did not happen. And then lastly, I would say you see some very unique signs, behavioral signs in children that have been sexual abused sometimes, which is sexual behavior. So inappropriate sexual behavior or acting
Yes.
out sexual behavior in a child that shouldn't have any idea about that is definitely a warning sign.
Well, we hear about all these horrible things that can happen to kids. So, on the flip side, what's been demonstrated or proven to help both children who are abused as well as their parents? In other words, what's the hope for a good outcome for all involved?
Yeah, that's an excellent question. It's a hard one because, as we've talked about so far, there's a lot of different layers that are causative. And so I always like to say, let's reflect on the things that are within our control as physicians and as parents. And I would say that first, if a child reports something or you start to see some of those signs that I talked about before, take it seriously. Even the most well-balanced or well-seeming child, if they're going to say that, we need to take those reports seriously. So prevention is one of the most important aspects. And then as far as treatment goes, the medical evidence suggests that counseling will help, that if there are more serious psychological manifestations, that treating things like depression and anxiety would certainly help. And then I would say as Catholics, again, spiritual help through prayer, through family prayer together and for healing is very, very important. Remember, we're talking about resilience in the aftermath of trauma. And we know that spirituality helps children to be more resilient and to better manage their psychological health. And so anything we can do to promote that would work.
I think one area that helps to promote that we might not realize is that if children live with both biologic parents, there's a very different chance that child abuse or neglect will happen. Would you comment on that?
Yes, I think that's one of the most underreported things, and one of the ways we can help to prevent child maltreatment. We know that an unmarried mother or an unrelated biological male living in the home are both independent risk factors for child maltreatment. Now, when I say that, I'm not impugning single mothers, certainly, or saying that if this is your living situation at home, that, oh, your child's going to be abused and that's a terrible thing. I'm not saying that. But what I am saying is we know that what's protective is a man and woman, where the man is the biological father, and we know that marriage is protective. Both of those things would reduce the risk. So whatever we can do within our society to advocate that, within our own families to advocate for that, I think we should do that. I'm not suggesting that, let's say you had a baby and you are not married to the father. I'm not saying go off and marry the father to prevent your child from being abused or something like that. There are wonderful single mothers out there who are doing the best that they can and would never harm their child. So I just want to point out, though, that there is a benefit to marriage. And again, here's where we see what the Catholic Church teaches and promotes comports with the science. This is not just a moralizing church. It's a church that understands human nature. And by understanding human nature, we can better understand our health and promote it. Good, strong nuclear families are the best defense we have against the things we can control. And for the things we can't control, like poverty, outside stressors that come into play, sometimes addiction in the home or substance abuse in the home, those are things that we have to have other solutions for. Let me say one other thing, Tom, which is intimate partner violence or domestic violence is one of the highest correlates with child abuse. So there are families out there that I know are listening in which there is violence against the mother in the home. And we should really think about how we want to prevent that. If we want to prevent child abuse, we can't have a child, and there are millions of children in America that undergo this today, where they are seeing their own mother be beaten by their father in the home, or be yelled at, screamed at, abused verbally by the father in the home. That promotes violence later in life. And that eventually, even if the mother is the only one being harmed, so she thinks, or so they think, eventually there's a high correlation between domestic violence and child maltreatment. So I just want to say a word about that. That is something else we can do that's concrete. Try to prevent that, screen for it as physicians, and stop it when it occurs.
Ashley, in the last 45 seconds, what's the most important message that you want to leave with viewers about child abuse?
I think one of the most important messages is certainly, if we really want to do something about this crisis that's enveloping our country and our world, that is child abuse, we need to make sure we strengthen our own prayer life within our families. Our church has a credibility crisis, as many of you know, with the sexual abuse scandal that has hindered our ability in many ways as the one true church, the largest institution that really can tell children and teach children that they are of God and from God and have invaluable worth. And I think we need to therefore pray for reform within the church, pray for good and holy priests that can lead by example. I think within our families, we need to pray for these children that have suffered abuse, physical, sexual, and neglect all around the world. I think we need to pray for ourselves as parents to be able to set good examples. And finally, that last bit, which is every action we take within our spiritual life and our prayer life should be building up our children and making sure that they have self-esteem and self-worth by teaching them that they are God's creation. Nothing more could be more valuable than to prevent child abuse, but also should the unforeseen and horrible trauma of abuse happen within our families, to be able to help a child heal and recover for them. Teach them that they are Jesus' children. They are children of God, and they belong to him.
Ashley, thank you. This was incredibly practical and giving hope to a very awful situation sometimes. God bless you. And thank you, viewers, for watching this episode of Vital Signs, your prescription for a healthy family. Brought to you by Shalom World TV and the Catholic Medical Association, where we are inspiring physicians to imitate Jesus Christ. Please join us for our next episode and share the good news of Vital Signs with a friend. And may God bless you. I encourage everyone to send us emails with questions that you want to ask medical experts. Please email us at vitalsigns@shalomworld.org. Your questions and comments will help us determine what topics we'll cover in the next season of Vital Signs.
Are you searching for fulfillment? Discover true happiness. Stay tuned to Shalom World.